Good afternoon, and thank you to everyone who's joining us today for the Friday version of the all-colleague COVID-19 update. I want to thank everybody for the great work that you're doing and for taking the time to become better informed as to what's going on, not just within Essentia, but across the state and across the country. First up on the agenda this afternoon, I want to thank our nurses and celebrate the nurses. This is National Nurses Week, and this is Nurses Year, the 200th birthday of Florence Nightingale, and this is a cohort of our nurses at Brainerd Lakes at St. Joe's in Brainerd. And what a beautiful presentation on the window there, and it really looks like spring outside. So I want to thank all our nurses for everything that they do, for meeting the challenges that we've had going forward, certainly with COVID-19, and for maintaining the spirit that they have. It's been very important. I appreciate it, our colleagues appreciate it, and of course, our patients and our communities appreciate it as well. We have some important things on the agenda today. First, we're going to talk about creating a safe environment for care. We know that there's a tremendous amount of anxiety in the community regarding COVID, and at the same time, an eagerness and a need to be seeking our care. So we want to spend some time on what we're doing that may have been different that we did pre-COVID to make our environment more safe to care. And we have a visitor today from our environmental services group. We're also going to spend some time on e-learning, on predictive modeling, to try to bring everybody up to speed on that. And then we'll have some time to answer some of the additional questions that have come forward since our last update. First of all, we are taking many steps to promote safety, and the safety is for our patients, for our staff, and for the community at large. And as COVID becomes more prevalent within the community, it's going to get to the place, and I think it's probably to the place right now, given what we're doing inside of our facilities, inside of our organization, you're much less likely to catch COVID inside of ours or any other medical facility than you are someplace in the community as general, such as a hardware store or a grocery store, somewhere along those lines. And what are the reasons for that? First of all, we're doing universal masking, whether you're in patient care facing or not. As all of us have experienced, we're screening our patients, staff, and visitors before they come in for any signs or symptoms of COVID or another respiratory-like disease or disease that can cause a fever. We are becoming and have become very selective on limiting people on our campuses. That's been one of the most difficult things for us, because it's always nice to have a family member with you or have a family member come and visit you in the hospital. And we haven't been able to do that because we're trying to limit the exposure of our staff, our patients, and trying to preserve the important and very scarce sometimes PPE that we need to consume. And the consumption rates go up as we have more of us on the campus. We are still encouraging social distancing in public areas, and we're going through a process right now to really minimize the use of our waiting areas and to make sure that when we have to use our waiting areas, we have the schedule set up and the spaces within the waiting areas that allow our patients to social distance there. And we've also expanded COVID-19 testing, and I'll have a comment on that a little bit later, including pre-op testing. We know that if a patient is infected with COVID-19 and has a surgical procedure, it can certainly affect their outcome, and it can affect the exposure of our operating staff and other staff that care for that patient. And we're separating our patient flows also with inside of our organizations, and I think our mobile testing centers are one of the ways we do that, to make sure that we're having the suspected COVID patients in a different spot, in a different area than we have our other patients as well. So let's get to one of your questions that really led to the presentation today. So for those locations that have contracted out our housekeeping services to come in after hours, have they been directed to clean differently or to focus on high-touch areas? Are they using cleaners that are effective at killing the coronavirus? Further, should they be wearing masks as well while they are cleaning? I believe they should. Could you please address this if necessary through the proper channels? So with this, we have Chad Herman today to talk about what our environmental services staff are doing to make sure that our facilities are safe. So Chad, I'll turn it over to you.
All right, thank you, Dr. Herman. So those are both great questions. We do view our contracted cleaning services as an extension of our environmental services team. We have frequent contact and communication, and we work closely with those groups. From the very start of this pandemic, we verified with all of our contracted cleaners that they were using a disinfectant that would kill the coronavirus. And in fact, most of the contracted cleaners do use the exact same disinfectants that we use in our hospitals. We have instructed these groups to spend the extra time cleaning the high-touch surfaces. And although we have not asked them to do necessarily anything different, we are stressing the importance of the work that they do every day. And in terms of the masks, although our contracted cleaners primarily work after hours in non-patient care areas, we are encouraging, or we are asking them to be wearing masks, and they should be. We're working with them to make sure they can comply with that, with the universal masking, by providing them cloth masks if they don't already have them. So we'll go back to that slide, Kim, sorry. So prior to COVID-19, we never really knew what was on the surfaces. And so environmental services always took the approach that we would use universal precautions. We selected chemicals that would kill spores, viruses, and bacteria, and we audited and verified the cleaning that we did. We have put some extra measures in place to prevent the spread of COVID-19 currently, but we haven't had to make significant changes to what we do. But it is really times like this that confirm the importance of the work that we do. Next slide, please. So here we have a couple of great photos of one of our EVS technicians in the hospital setting, wiping down elevator buttons and door handles, which are high touch areas. We really are spending extra time disinfecting our high touch and high volume areas and public spaces. Our emergency department, we're doing some extra measures in there, as well as the waiting rooms, and I'll get into those a little bit later. And also spending extra attention on our units that are caring for our COVID-19 patients. Next slide. So it's really amazing how high-tech cleaning and disinfecting has really gotten. And we at Essentia are very fortunate to have some of this technology. I will say I'm representing the East. I do have contact and work with our leaders in the Central and the West. And although some of the technologies that we may use or procedures may vary slightly, we all do have the same goal of providing the safest, cleanest environment for our patients and staff. And so we are using the ultraviolet light from our Xenix robots to add an extra layer of disinfecting in our patient areas and other areas as well. So these robots are set in room after a terminal clean, and they pulse UV light that will kill any bacteria that could be left on surfaces after the physical cleaning. This technology has also been instrumental in our PPE preservation. So we've deployed one of these robots to disinfect our N95 masks for reuse, and so that's been a great secondary use for these. We're also using Clorox 360 machines, and so what those are is they're able to mist an electrostatic charged bleach product. And what that does is it allows us to clean tough to reach areas such as, the underside of beds and furnitures, any cracks or crevices, as well as allows us to disinfect some of those waiting areas. So the technology allows us to disinfect those soft surfaces without getting them really damp. And so it's a great use there. So both of these technologies are being used in our COVID and rule out COVID rooms. And we are also looking at adding other technology to assist, such as vaporized hydrogen peroxide as another no-touch disinfecting technique. Next slide. So here's another picture of Ashley wearing her proper PPE. She assures me that she does have a large smile under there, even though you can't see it. And nursing has always been a great partner in helping keep our hospital clean. A great example of this teamwork is, as the organization continues to preserve PPE, nursing has taken on some of our patient room cleaning. And infection prevention and nursing have also been great resources in helping train and helping our staff follow all the guidelines regarding PPE, keeping them and everyone around them safe. Next slide. So in our clinic settings, we do continue to follow our pre-COVID cleaning procedures, which include using a hospital-based disinfectant that does kill coronavirus. We do rely on nursing to do our in-between patient room cleans. And we are, just as in the hospital, we are spending extra time cleaning our high-touch surfaces, our waiting areas, in those types of areas. As we do, and then at the end of each evening, our staff goes in and they do a thorough deep clean of the area. As we start to see our clinic visits increase, we'll work with our clinic leaders and IP, infection prevention colleagues, to see if there's any changes that we need to make to our cleaning our practices to make sure that we can provide the cleanest and safest environment for our patients and staff. And we will be looking at utilizing both the Xenix and the Clorox 360 machines more frequently in these areas. Next slide. So just finally, we all play a role in the cleanliness of our facility, and I would like to thank everyone that's taken it upon themselves to keep their work area disinfected and clean by wiping down those high touch areas within their office space. And we would encourage everyone to follow suit. And also, just for all of our safety, we just please continue to practice excellent hand hygiene and mask etiquette.
Chad, thank you very much. This has been very, very helpful. I hope that answers the question of many of us, and certainly for the person that sent in that request. I'm sure as we work our way through this, there'll be changes that we will make to our cleaning protocols, and we'll keep everybody up to date on those as those come forward. Predictive modeling has been a particularly popular subject at these updates, and we get a lot of questions about that. And based upon those questions, I want to thank our OL&D colleagues, as well as Sarah Manny and her team, for putting together an e-learning for predictive modeling to try to get us to the same foundational learning so we can better interpret the information that's coming forward to us. So with that, I'll turn it over to Dr. Sarah Manny, our Chief Medical Information Officer and the leader of the predictive modeling team, to walk us through that e-learning this afternoon.
Wonderful. Thank you very much, Dr. Herman. Over the last few weeks, you've met the members of our modeling team, which is a collaboration between the Essentia Institute for Rural Health and Enterprise Analytics. And last week, we added a new member to our team, Colleen Brown from OL&D. She's a designer of the educational design, and she took our thoughts and our vision and what we are seeing in the models, and she created it into an interactive learning experience. So we're really excited to show it to you today. We feel that this is an important communication tool that we would like to get out to all of our colleagues and staff. As we're looking at the models, we're becoming more aware that we're likely not going to see a sustained surge, and much more likely we are going to have waves or peaks or spikes, and this learning helps explain that. I'll go through it quickly here today, but it will also be on the COVID tile and available for you to do at your own pace, and I encourage you to do so. I just would like to warn you, my first time that I went through this e-learning, I felt it was very moving and it was actually a little bit emotional. So just like we talked about before, just a warning that as you go through this, I encourage you to pause and reflect and recognize even anger and fear are normal. Just one moment and I will share my screen. And Kim, do you see my screen?
We got her.
Okay, thank you. These are common questions that we get, and common questions that I think everybody is feeling right now. When will this be over? What we know is that it's uncertain right now, and that's how we feel. This is a definition of the surge. We've been talking a lot about what surge is, and so we wanted to define that. But what we know is that our predictive modeling tools will help us determine when it might arrive and how many people it may affect. But we know that they're not absolute and that the truth may change for many different reasons, and this will help us understand a little more. There are many reasons for the variability in the modeling, and we highlighted 3 sections. And this is interactive, and you can click through each one. The social policy, and we refer to this as the stay-at-home order, social distancing, wearing a mask, and many different things. There's variability in testing, whether there's an increased or decreased testing capabilities, whether we're able to test the asymptomatic population in a much more robust way than we have been. It'll be helpful to know if other people have COVID than we originally thought. Because COVID is a new disease to us, we don't know a whole lot about it. So as other parts of our country and our world go through this, we are taking all that information and trying to discover more ways about how this behaves. Here's a graphic that is just a demonstration tool showing what would have happened if we did not have any intervention. You can click through these and I can show you very quickly. If we had no intervention, such as a stay-at-home order, we would likely have received a very large peak of patients that were quite ill and needing our services. With social distancing implemented, that curve has shifted to the right and it has flattened it significantly. And this is what we're not quite sure about right here. What happens when we have social distancing measures that are implemented and then lifted? Very likely we're going to see waves or more than one wave, a plateau, perhaps a sawtooth or a spike. We're very unsure as to how this will appear. And we're starting to think of this more in our local areas as hotspots. And how do we deal with those hotspots? This is a wonderful graphic, and thanks to Colleen for making this really easy to understand. The 1918 flu pandemic hit communities around the world, and there's some interesting information about how other cities in our country dealt with it. And you can hover over each of the cities to learn more information, and I won't go into them in detail. However, I would love to highlight Minneapolis. So we have the history of doing the right thing in Minnesota. Back in the 1918 flu, Minneapolis accomplished the lowest death rate by implementing social distancing earlier and for a longer period of time. So looking back in the history books, we know that we're doing the right thing. With all of these variables that we talked about, we know that those peak numbers are going to be very unstable, and we try to stress that these numbers are directional and for operational leaders, and we're unable to give it with any certainty when we will experience a peak surge. We like to highlight some things that we don't know, and you can click through these panels to learn more about what we don't know. Like we talked about a little bit earlier, we don't know a lot about this particular disease and how it will behave. We don't understand fully how it's transmitted to others. We're not sure about the role of protective antibodies. We hope to get more information as we see other people move through this before us, and we will definitely be changing the slide as we understand more, but we're not quite sure what herd immunity means. We often get a weather question, and gosh, the weather has gotten so nice and everybody wants to be outdoors. We're unsure how this virus will behave in the warmer weather. So what does that mean about second and third waves? Can we do any predictions at all? At this time, we're working on different scenarios. And like I said, we're working on hotspot thoughts. We're looking at different doubling rate scenarios. And we're continuing to provide that information to our leaders for operational planning. Every single day, throughout the day, we have a team of researchers who are actively looking at this data, both locally, nationally, and worldwide, to help us plan for this. So what's really important is that you should know, like I said, we have a group looking at this every day, that the predictions could change at any time based on many different factors. And it is very likely that we'll see more than one surge, spike, or sawtooth until we understand about immunity and until we have a vaccine. And finally, we're here with you. Thank you, Dr. Herman.
Thank you very, very much. Let me go back to share my screen again, Kim. Let's see what we can do here. There we go. There we go. Now let's get to some of our questions here. I know that the presentation that you just saw and if you take a look at it and spend some time on it, that may cause you to have other questions about this, and that's great, because I think the better we all understand this, the better we all understand where we are and where we can be, I think the better we can all cope with some of the uncertainty that comes forward from this. So let's spend some time right now on the questions that you were kind enough to send in over the last several weeks. One of the questions was, can you share the members of Essentia's incident management team? Happy to do so. First of all, what is an incident command scenario? And really what it is a national standard for crisis response. And we have used that before in Essentia. We've used it in each one of our markets at any particular given time. I can remember here in the East Market when we did it for the Husky Oil Refinery explosion. We've done it in the Brainerd Lakes area when we've had tornadoes and things like that. It's happened in Fargo when there's been flooding and things like that. So we have used it before, but it's been interesting. It's generally been for things that were outside the organization that we needed to be prepared for. And it's been generally due to environmental causes, not because of infections. And there's been a beginning, a middle, and an end in a very short period of time. But the incident command system facilitates our ability to make decisions quickly across multiple departments and uniformly. So in a common way of phrasing it, we need to know what the right hand needs to know what the left hand is doing. And specific roles are called out at the facility and organizational level to respond efficiently to the crisis. So at Essentia, we have an incident management team that consists of the people here, and we'll go through what the roles are in just a second. And what we do is we meet literally every day, and then we make decisions and then push those decisions or that information down to the west, to Brainerd Lakes, and to the east. And then the incident management team members there, the leader, Dr. Vetter in the west, Mike Larson in Brainerd Lakes, and Dr. Stephen here in the east, then push those out to the individual teams and individual facilities across those particular markets. The incident management team, we're fortunate to have Dr. Pete Henry as our Chief Medical Officer and our incident commander. And then as you can see, we have public information officers, liaison officers, and others along the line there to make sure that we have the specialties and the resources as well as the expertise that we need to take the information that comes in every day, to make decisions based upon that information, and then share that information going down further. I know I'm going through this rather quickly with all the names here, but as you know, we do record this and post this, and you're welcome to go back out and take a look at this again. So we have ambulatory care, medical and technical specialists. We have legal with Mike Waters. Pat DeLon is one of our operations chief, and as you can work your way down the line here, you can see what everybody's role is that helps inform the decisions that are being made, as well as bringing information to the table for those decisions to be made. We also bring in other subject matter experts depending upon the topic. So if we're talking about COVID-19 testing, we bring in people from the laboratory, facilities and logistics, or questions about cleaning, as we just covered in the previous question, we bring in John Vidmar and his team. When we talk about colleague well-being, we bring in Stacy Judel and other people within our organization who have an expertise in both the knowledge and the operations for those particular types of questions and policies. And each market has an incident command team as well in order to be able to disperse this information out as it's being decided and to bring questions up to the main incident command team here at Essentia Health. So I want to thank everybody for all the work that goes into this. There's a meeting that lasts an hour every day, but there's so much work that goes on in the background to prepare for that meeting, and I want to thank everybody for all that work. So we have another question about testing this time. The Duluth location testing site can be hard to find. Are there other areas of the Essentia Health market opening up testing sites to people with symptoms, even without an e-ticket or e-visit? If that's the case, why can that happen in Duluth? Well, one of the reasons we have that testing site where it is because, and we're very thankful to Voyager Bus and the Croix family for allowing us to use that, is that it provides a safe environment for our staff in order to provide that testing. It's warm, it's out of the sun, it's out of the rain, it's out of the wind. We have lost our testing site tents at multiple areas due to inclement weather across the Essentia landscape. So there are things on the web that can assist you in finding that test site. But we do know, and we do have other test sites across that you can go on to essentiahealth.org and find. Let's talk about opening up testing sites to people with symptoms even without an e-ticket or an e-visit. A COVID-19 test is the same as any other test. So it would be like showing up for an X-ray or a CT scan or to have your blood checked. Each of those has to have an order by somebody on the healthcare team in order for that service to be legally provided. So we can't do that in Duluth, and that can't happen in other places as well. There are certain states that are opening up testing on a very limited basis to very specific groups for testing even asymptomatic individuals. That has not happened in the state of Minnesota yet because we're still having difficulty getting the testing swabs, the viral media, and other things that it takes to do the test. We are hoping by the end of this month that we will have as many as 20,000 tests available each day. And we're hoping that as the testing situation becomes more available, that we can start opening this up in a very disciplined manner to find out what's happening in a particular area at a particular time. As was mentioned in the education just provided by Sarah Manny, it would be useful for us at a particular time to determine what proportion of the people in our communities have been exposed to COVID or infected with COVID or are post-COVID. As testing becomes available, we'll be working with the state and with our public health colleagues to be able to do that and to offer more testing. That will help inform us and answer many of the questions that we still have about the SARS-CoV-2 virus and COVID-19 as a disease. A little fun Friday note here. Here's the security guard at the mall. I had an opportunity to take a picture of a bear that was out at the mall, and you can see the Essentia Health sign in the background for our Center for Personal Fitness. I know that some of us have perhaps let our hair grow and haven't shaved as often, and perhaps may have put a few pounds on during our work here and not being able to go into work or limited time inside the office. So someone actually posted that he wants the governor to open Essentia Fitness Center as well. And, you know, that's a pretty big bear for this time of the year. I want to thank and he's not leaving until it happens. So it's probably out of the wind there, a nice warm spot for him to stay. And I think I don't know if that's a him or a her, but I do know because he was hanging around Noodles that the public has named this bear Noodles. So Noodles is taking a little nap there. I want to thank everybody for serving our patients and serving our communities and serving your colleagues. Please email your questions to liveupdatequestions@essentiahealth.org, and we'll do our best to get the experts to answer those questions and to better inform us all. And I look forward to seeing you next Tuesday, May 12th at 4:30, where we will have our next all-colleague COVID-19 update. Thank you very much. Take some time over the weekend to take care of yourself, and we look forward to seeing you again next week.